Here's a slide of what we just discussed, which moves us on to the red blood cell life history. So, erythropoiesis, so red blood cell production. This process normally takes about 3 to 5 days, and it involves four major developments: a reduction in cell size, an increase in cell number, the synthesis of hemoglobin, and the loss of the nucleus and other organelles. It begins when hematopoietic stem cell becomes an erythrocyte, colony forming unit, or CFU. If you guys are in anything medically related, you've seen CFU a lot, and this has receptors for erythropoietin, so EPO, a hormone that's secreted by the kidneys. EPO stimulates the CFU to transform into an erythroblast, and erythroblasts multiply. They build up a large cell population, and they synthesize hemoglobin. So when this task is completed, the erythroblast nuclei shrivel. They're discharged from the cells and are consumed by bone marrow macrophages or macrophages. So macro, large, phage, to eat. This is what eats the dead cells, essentially. So once the nucleus is discarded from the erythroblasts, we now call it a reticulocyte, and they leave the bone marrow and enter the circulating blood. In a day or two, the last of the polyribosomes disintegrate and disappear, and the cell is a mature erythrocyte, or a mature red blood cell. And this is a little pictorial for that. So HSC to CFU, precursor cells, erythroblasts, reticulocytes, to then mature red blood cells. So if you guys remember negative feedback loops from Anatomy 1, red blood cell count is maintained through a negative feedback loop, so continues to happen. If red blood cell count should drop, it could result in hypoxemia, so oxygen deficiency in blood. How does hypoxemia happen? It could happen from hemorrhaging, right? And it may result. How does red blood cell count drop? That could happen from hemorrhaging, from blood loss, from a cut or anything like that, an injury, and that can result in hypoxemia, which is oxygen deficiency in the blood from severe blood loss, for example. Other causes could be high altitude, increased exercise, especially increased exercise in high altitude. If you've ever exercised in Denver, Colorado, you'll understand what I'm talking about. And another example could be loss of lung tissue and emphysema. So back to the Colorado thing. So if you were to move to Denver after not, living in a high elevation area, the lower oxygen level at that high elevation would produce temporary hypoxemia and stimulate EPO secretion and erythropoiesis. So the blood of an average adult has about 5 million red blood cells per microliter, but people who live at high elevations, they actually may have counts of 7 to 8 million red blood cells per microliter due to the lower oxygen levels up there. So iron is a critical part of the hemoglobin molecule and one of the key nutritional requirements for erythropoiesis. We lose iron daily through urine, feces, bleeding, and we don't have very high absorption rates of iron, so that requires us to eat about 5 to 20 milligrams a day. A pregnant woman actually needs 20 to 48 milligrams a day, especially in the last 3 months, to meet both her needs and the needs of the fetus. Dietary iron exists in two forms, so ferric and ferrous ions. Stomach acid converts most ferric and ferrous ions. the only form that the small intestine can absorb. So this protein is called gastroferritin. So it's produced by the stomach, then binds the ferrous ion and transports it to the small intestine. Here, it's absorbed into the blood and binds to a plasma protein called transferrin and travels to the bone marrow, liver, and other tissues. Bone marrow uses iron for hemoglobin synthesis. Muscle uses it to make the oxygen binding protein myoglobin, and nearly all cells use iron to make electron transport molecules called cytochromes in their mitochondria. So you guys remember the mitochondria, the powerhouse of the cell. The liver then binds the extra iron to a protein called apoferritin, making an iron storage complex called ferritin. And then it releases the iron into circulation as needed. So, big importance with iron. So, some other additional nutrients required for red blood cell production is vitamin B12 and folic acid, both of which are required for rapid cell division and DNA synthesis that occurs in erythropoiesis. And then vitamin C and copper are cofactors for some of the enzymes that synthesize hemoglobin. So, as red blood cells age, they don't typically last past 120 days. But as they age and its membrane proteins deteriorate, the membrane grows increasingly fragile. So many red blood cells, they die in the spleen. The spleen has also been called the erythrocyte graveyard. And the spleen has channels as narrow as 3 micrometers that severely test the ability of old, fragile red blood cells to squeeze through the organ. So old cells, they are trapped, they're broken up, they're destroyed, and an enlarged and tender spleen sometimes indicates diseases in which red blood cells are rapidly breaking down. So that's something that doctors can look at. Hemolysis, so the rupture of red blood cells. Hemolysis releases hemoglobin and leaves empty plasma membranes. The membrane fragments, they are easily digested by macrophages or microphages, however you want to pronounce those, in the liver and spleen. But hemoglobin disposal is a bit more complicated. So it can be disposed of efficiently, or it can block kidney tubules and cause renal failure. So that is, something that can happen here. And then macrophages, they begin the disposal process by separating the heme from the globin, and then they hydrolyze the globin into free amino acids, which can be metabolized as fuel, or they can be recycled for protein synthesis. So getting rid of the heme is another matter, but first the macrophage removes the iron and releases it into the blood, where it'll combine with a transferrin, if you'll remember from a couple slides, and is used or stored in the same way as dietary ion. So the macrophage converts the rest of the heme into a greenish pigment called biliverdin, which we don't hear a lot about, but VERD indicates green, so that's a good trick to remember that biliverdin is green, and then further converts most of this to a yellow pigment called bilirubin. So bilirubin is what you are probably a little bit more familiar with. Bilirubin is released then by the macrophage and binds to albumin in the blood plasma, and then the liver removes it from the albumin and secretes it into the bile, where it imparts a dark green color as the bile becomes concentrated in the gallbladder. So good old bile pigments of biliverdin and bilirubin. And then from there, the gallbladder discharges the bile into the small intestine, where bacteria converts the bilirubin to urobilinogen, but we're not going to focus on that one too much right now. So any imbalance between the rates of erythropoiesis and red blood cell destruction can produce either an excess of red blood cells or a deficiency of red blood cells. So if we have too many red blood cells, it's called polycythemia. Conversely, if we have low blood cells, it's something called anemia, which you're probably a little bit more familiar with. Oh, you might hear my huskies in the background. I do apologize. I have two huskies. I will pause the video right here.